Hi, this is Dr. Phil from Welcome to Wellness with Brooke showing you, demonstrating the exercise to do for when you have low back pain. All right, so Brooke, take it away. So the first one we're going to do is the knee to the chest. So you just bring your knee towards your chest and you let it release. And then you do the opposite side and you don't hold it as a muscle stretch. All you're trying to do, just if somebody was really hurting Brooke and they could only go a little ways. So most people, if they're in pain, they might not even be able to go that far, but go as far as you feel comfortable. And then, so you'll see as she keeps doing it back and forth, she'll go further as she goes along if she were in pain. Of course, she's doing great, getting her regular care, doing her all the exercises, and so that's the way you'll get too. And so you'll notice you can do 15 to 20 reps on each side. If you're in pain, if it aggravates it as you do this, then you have to stop and let us know. The next exercise is to go to the knee to the opposite shoulder. And again, not holding it as a muscle stretch, just bringing it over and allowing your joints to move. You're pushing fluid out of the joints. And so you'll do the same thing, 15 to 20 reps, knee towards the opposite shoulder. Then we go into a figure four. And so this figure four, now on this one is a muscle stretch. And so you want to hold this one 15 to 30 seconds. Now if it's painful, you can start off just with a less of a motion and work into a deeper motion as you go. And you notice as she's pulling behind her knee from the other side, that she's able to get the figure four to go into a deeper stretch. So it's the opposite leg that you're pulling is allowing the leg that has the figure four to make the muscle stretch. You'll feel it. Just show them where they're going to feel it, Brooke, when you get to the other side again. So they're going to feel it through...
I'm feeling it right through here.
Here, yeah. And you'll feel it through, a lot of people with back pain will feel it through their back as well and around the side as well. That's a perfect technique right there. And again, hold it 15 to 30 seconds and you're going to alternate doing one side and then the other for 15, 30 seconds. Then the next one is a lumbar rotation stretch. So you'll notice how Brooke has her feet planted and she will take, and so her legs are at a 90-degree angle from the lower leg, and then she'll go with a nice gentle rotation. Now you won't go as far as she's going possibly at first, and you'll work up to it, but you'll roll, and now you're allowing the facet joints in the back, which are the ones that most commonly are needing help from your chiropractic adjustment. You're allowing these to work better and hold the adjustment better by doing this exercise. And Brooke, if that's too easy for them, just show them the one where so you're going further and you'll go further as you go, and then we can cross the one leg over the other one and you can go even further. Yeah. And then cross the one knee right over top as well. Yeah, and then you'll see that gives you even more leverage. And you can stretch out, and you'll feel that stretch even more through the butt and lateral thigh, and the back, of course. Now, all of these can be done as well as a muscle stretch, so the knee to chest, the knee to the opposite shoulder. Once you've warmed them up with the joint motions like that and push the fluid, the inflammation out, then you can all go back and hold them as a muscle stretch. And that would again be 15 to 30 seconds. Now the next thing is a nerve floss, very important. And this nerve floss, if you have any pain going down your leg, this is very important to, and watch how Brooke just brings it up to a point, and as soon as she feels it, she'll back off and go backwards. And what you're doing is you're flushing the fluid or inflammation off of the nerve that goes down your back, the sciatic nerve that goes down from your back down to your leg. And so she's not pulsing, there's no fast, there's nothing really abrupt. She's just, as soon as she feels it, she gently backs off towards the neutral. That's the perfect technique. And so if she as she got better and better, then she would actually even attach, a strap, and she could pull the foot down towards her head. So just show them, just demonstrate where she pulled, yeah. And that would actually pull that foot right down and would actually come down like this, and that would be even more of a nerve floss. That's when your pain is pretty much gone and you want to push the nerve even more. Good. The next one's what we call the PNF for the lower back, or the sacroiliac joint specifically. And so what you'll notice is Brooke will pull and hug her knee in. You always want to warm it up first, knee to chest many times, and then you got to this position now and it feels comfortable. And then now you'll push your leg into your hands, and she'll resist. And do this at about a 50% of maximum for this, and then she'll stretch it up after, and you'll notice she'll go further after she's done the resistance, and she'll hold that as a stretch again, 15 to 30 seconds. She won't allow the angle to change. She'll keep it there, and she'll push and resist again. Again, 5 seconds, 50% of max at most, 30 to 50%, and then she'll stretch 15 to 30 seconds. Don't forget to do your breathing that we taught you at the office with the inhale and exhale. Excellent. Anything to add to that, Brooke? No? Awesome. Well done.